So all things we've looked at as being consistent with vaccine injuries in the past, explicable largely by the systemic distribution of the lipid nanoparticles containing the mRNA and the production of the spike protein in diverse organs in the body, as well as other systemic effects. Conclusions in the paper: the consistency seen amongst cases in this review with known COVID-19 vaccine mechanisms of injury and death. So these are recognised vaccine-induced mechanisms of injury, and obviously, as we explained in just a couple of examples there, the mechanisms by which these lead to death are well understood. Coupled with autopsy confirmation by physician adjudication. So we've got the autopsy adjudication. The pathologists have seen this on the organs that they're cutting up on the bench, and physicians have adjudicated that it's likely to be causal, suggesting there is a high likelihood. It's not definite, it's a high likelihood of a causal link between COVID-19 vaccines and death. Further urgent investigation required for the purposes of clarifying our findings. So no dramatic conclusions being claimed here. They're just saying, look at this. Although it does point out that if it is right, the implications are immense. And it does make you really wonder why this was withdrawn twice and rejected by many journals, as we looked at. Well-known journals that rejected the piece. Anyway, you can let me know why you think it might have been rejected. You might think it's a rubbish paper. Look at it and say, oh no, these rejections were quite justified. Fine. Or you can think there might be another reason. Let me know. Right. Also, mechanisms of action were discussed in some detail in the paper. I can't go into it in detail. We'll be here all night. Through May the 31st of 2024, so through to the 31st of May 2024, just in the United States, the VAERS, the Vaccine Adverse Event Reporting System, 1.6 million adverse events reported. And we know that typically only a few % of adverse events are usually reported. 37,647 deaths were reported, 28,000 myocarditis and pericarditis, 21,000 heart attacks, over 9,000 thrombocytopenia, that's the lack of the platelets, the clotting and the potentially hemorrhage reported. Now, criteria of causality from epidemiological perspective. These are basically the Bradford Hill criteria. This is classically how we work out or deduce the likelihood of a causal relationship in a correlation. And Austin Bradford Hill and Richard Doll used this to identify the causes of that smoking caused lung cancer. So it's well recognised way of doing things. So criteria of causality from an epidemiological perspective, biological plausibility. So there's mechanisms of action that make sense. You know, we're not saying it's because the moon was high or there was a lot of meteors that night. There's a biological plausible mechanisms, and we looked at a few as we went through on the discussion there. Temporal association means the vaccines came typically a week, but sometimes up to 14 days before the death. Internal and external validity. So there's internal validity within the post-mortem studies. There's external validity with other excess deaths studies. Coherence between epidemiology and bench studies, and analogy with other conditions, and reproducibility with each successive case report of death after COVID-19 vaccine, combined with population-based studies describing mortality amongst the vaccinated. So quite a lot of coherence there being demonstrated. So there we are. It's now in a peer-reviewed journal, so that's why we're able to talk about it again. It had been a very widely downloaded paper, so interesting to see how this one goes. It's now back in the peer-reviewed literature. So you can read it for yourself, look at the link. It's actually a very readable paper, very readable indeed. And let me know what you think. But for now, I would have thought that is enough to suspend the mRNA vaccine program until we know more accurately whether this paper can be substantiated or not. You'll have your own views, no doubt. They're just mine. Don't take my opinions. Think for yourself. And as always, thank you for watching.